this is interesting, actually. Today is World Obesity Day. Now, we're often taught, aren't we? Well, quite rightly taught that we shouldn't discriminate against people because of their gender, their race, their religion, their sexuality, their disability, or even age, people say as well. Because these are things that people can do nothing about. Your weight, perhaps, is something you can do nothing about. And yes, a survey as part of today's World Obesity Day has found that 81% of British adults believe that people with obesity are viewed negatively because of their weight. Well, let's talk about this with Dr. Stuart Flint, who's a psychologist and senior research fellow in Public Health and Obesity at Leeds Beckett University. Good morning to you.
Good morning.
Good morning. In terms of this day, this World Obesity Day, do we know what the point of it is?
The World Obesity Day in 2018 is dedicated to the theme of weight stigma and discrimination. It's about raising awareness of how prevalent weight stigma and discrimination is and trying to move people towards intervening and starting to reduce weight stigma and discrimination, because we know it has a very detrimental impact on people's health and also their engagement in healthy behaviours.
Well, the thing is, I mean, it is unreasonable, I would say downright stupid, and of course illegal to discriminate against somebody on the grounds of something they've got no control over. Irrelevant things like the colour of their skin, the gender they are born, if it's not a job that involves, I don't know, very heavy lifting. And yet discriminating against somebody because of a choice they have made to get fat, you could argue, is maybe perfectly reasonable. Now, shouting at someone in the street, being rude to someone, offensive, insulting, absolutely not. But an employer, for instance, deciding between somebody who's got a perfectly healthy body and someone who's very obese for the same job with the same qualifications would be legally perfectly entitled, and I would think probably quite sensible to say, I'd rather have the person who looks like they take care of themselves. They'll probably be a more useful employee. They'll be less likely to get ill. They probably have got more sort of self-control, more organisational ability. They're probably more active. I'd rather employ that person. And presumably you think that sort of discrimination's wrong. I would have thought that was just an employer being really sensible.
Well, what we're talking about there is a lot of assumptions. What we're talking about there is an assumption being made on somebody's body shape or size. Is there objective data? Are people collecting objective data to say that somebody with obesity is unable to do a job, and therefore we're not recruiting them, compared to somebody who with normal weight? Well, we don't have that. People are being discriminated based on an assumption, and there is no data that says that people with obesity are unable to do certain roles. In fact, what we see is that in many roles, it doesn't have to be physical jobs, could be very much desk-based jobs or other. It doesn't really matter. What we're seeing is that people are being overlooked, and actually people who are much more qualified for doing jobs are being overlooked compared to other people based on an assumption just by looking at somebody. And going back to your point you made at the start, that's exactly right. Stigmatizing and discriminating against people is unacceptable in our society. And we can say, well, it's about choice. People have choice over whether they become overweight or with obesity. Well, actually, we know there's a lot of factors which aren't to do with personal choice.
But those factors would be exactly the sort of reasons why people, if someone is so deeply troubled they're eating themselves to an early death, or because they're just very lazy and they just want to eat cream cakes on it, whatever the reasons why, an employer, for instance, would be totally entitled to say, I don't want to employ that person. That's not stigma. That's not making unreasonable assumptions. It is a matter of fact that people who are. I've hired many people I've really hired over the years have been cleaners and nannies. I'm as middle class as you get. Never hired a fat cleaner. Never hired a fat nanny.
Mm-hmm. Well, what we're talking about there again is a lot of assumptions. Let's say
no. You keep saying the words assumptions. No, Stuart. You keep saying these are assumptions. No. These are fact-based judgments that people make.
Facts. Let me put it to you. Would you support discrimination or stigma towards other types of health conditions? Let's talk about, let's say...
It's not a health condition.
Cancers. Let's talk about cancer.
It's not a health... Being fat isn't a health condition.
Cancer. Let's talk about cancer, because cancer, obesity, it's the same determinant. But you would not accept...
What?
I'll be surprised if you turned around to me and you said we should be stigmatising people with cancer.
No, okay. I'm not saying we
Right.
should be stigmatising. I think that's a different word. People, look, you've got a higher chance of getting cancer if you are obese, which is a factor. But people who can lead completely healthy lives can get cancer, as we know. We'll all know someone in our own lives who has gone through that. The point is that you're treating. This is the whole thing now. We're treating people with obesity as if it is a disease, as if it is something that's just happened to them. It isn't something that happens to people. Like happens to children when parents are unhealthily force-feeding their kids, absolutely. But the reality is people do make choices in their lives. And we're not talking about someone being a little bit overweight. We're talking about, say, people who are obese, who are clinically obese, who are unhealthy. Why would an employer with two people in front of them with the same qualifications choose the person who's more likely to be off sick than the person who isn't? That would be crazy, wouldn't it?
There is no data that says that people with obesity are more likely to have heart
disease, more likely to get cancer. Come on. High blood pressure, high cholesterol.
You have that for many other health conditions, but you're not sitting there saying we should be discriminating against other health conditions which might well be within people's control. So as I made earlier, the point I made earlier, you're not saying we should discriminate against people with cancer, for instance. Okay, and I totally agree. We shouldn't be doing that, but we shouldn't be doing that for obesity either, because like obesity, there are some instances where there is more control and there's more likely that you might have a health condition because of choices that you've made. But actually,
give me some examples. Give me some more examples. I mean, we're not talking about the result. Again, look, if someone's got cancer because of obesity, they've still got the obesity, haven't they? So, give me another example of something that is going to be something people can discriminate on that someone else has chosen. Give me an example. I mean, if someone chooses to have, sort of have tattoos on their face, well, that's fine. But then I can choose not to employ. I mean, people make choices in their life all the time. How much food you put into your gob every day and how much exercise you do is your choice. Now, it's easier for some people to make those choices. It's harder for others. Some people can eat anything they want and they never put a bit of weight on. They can be healthy for the whole of their lives. And that lucky them. But the reality is, we're not talking about people who've just got a few extra pounds because they like a bit of cake and a glass of beer at the weekend. We're talking about people who are clinically obese.
This is a horribly simplistic view that you're essentially giving to the public currently, and it does not match the data. It doesn't match the evidence. If you look at the 2007 report from the government, it tells you that obesity is extremely complex. There are over 100 different factors that contribute to the causes of obesity. It's not simple. It's not just about moving more and eating less, which is what you're trying to give to the public. And unfortunately, that is a public disservice.
I don't claim to give a public service. I'm simply giving my views, but I suspect
an opinion, and you're giving an opinion, and the public want evidence. Let's talk about the evidence, because the evidence is not obesity is simple. The evidence is not.
The evidence is that obese people are unhealthy. That's the evidence.
That's not what this is about. What this is about stigmatizing people based on a judgment you're making about body shape or size.
No. People are making a judgment about the person and the choices that they make. For instance, we're told when we go to a job interview that you should look smart, you should polish your shoes, have clean fingernails. Now, is it relevant whether someone can do any job of any sort, whether they've got clean fingernails or not? No, absolutely not. But it is very telling that someone doesn't bother to clean their fingernails because they're not paying attention to personal hygiene and making an effort for that interview. It's about how they might, for instance, interface with customers in the future. Now, whether or not, if someone is choosing through their life to lead an unhealthy lifestyle and make poor choices in their life, that is, I think, an indicator to an employer that person might not be the ideal employee. Now, I've worked with a number of people over the years who are overweight, obese. I've had problems being overweight in the past. I mean, and lots of people have been fantastic people at their job. I'm just saying that when we talk about discrimination, not people shouting at someone in the street and being foul and horrible when it's none of their business, but when it comes to people actually making choices in their lives about who they want to employ, for instance, employers are making very sensible, well-founded decisions.
No, they're making assumptions based on what the person looks like. That is not, if they are collecting information that objectively says you are leading an unhealthy lifestyle because we know that you're doing this behaviour, that behaviour, etc., that might be a different story, but we don't have that.
Okay.
People come into an interview, as you said yourself, come into an interview, and based on how somebody looks, I'm now making a judgment. A judgment. It's not evidence-informed information. It's a judgment on how somebody looks.
We're going to have to agree to differ on this one, Dr. Stuart Flint.